Okay, thank you so much for being here this morning. We appreciate you being the soldiers that managed to be here at 9 o'clock. And so my name is Samuele Tonello. I'm a senior research coordinator at EuroHealthNet. And today, together with my colleague Gabriella Sutton, project coordinator at EuroHealthNet, we will help moderate this session. And this session will be on food and food systems, and especially on food system policy. So, of course, I will make the introduction really brief, but just to mention what food system is that we are not considering only what you eat, what you put in your mouth, but basically like we consider food from the moment you put the seed to when you plant it, to when you harvest it, when you distribute it, when it is sold, when it is consumed, and afterwards the waste. So if you take all the individuals in this system, all the relationship, here, it's like you have this whole system related to food, and how we manage this system, how it is governed. It is really important for our societies. It is really important because it has always been a pillar of a healthy and sustainable food system. And today, as you can see from the title of our session, the problem is that if you look at the European food system, it is not healthy and it is not sustainable. And so here today we want to discuss on the why and what we can do about it. So it is not healthy and not sustainable because from the environmental point of view, just to mention some, intensive farming, greenhouse gases emission, loss of biodiversity, make it very difficult to be sustainable. If we look at the social and economic point of view, we have a system where for the local and smaller producer, it is really difficult to compete against bigger actors in the food system. We talk about food security. At the same time, we have a system that produces new food billionaires every month, almost. And then, especially important for us, it's malnutrition. It's a leading cause of several non-communicable diseases. And if we take, for example, just obesity, we live in an obesity epidemic where 1 in 3 European citizens are overweight and obese. And with a forecast that if we continue with the status quo, we will reach 1 in 2. And these are not just numbers. This is really, they reflect on lives, disability years, and it's really, really problematic. So today I gather here my dream team, and so that I will present you, and we will discuss. The structure is very simple. We will have a first part of around 20-25 minutes where I will ask a round of 2 questions. And then this will really hopefully give as much input as possible for you to ask questions. We want to have around 20-25 minutes to really discuss, see what are your thoughts. I followed previous debates and I saw a lot of mention into food, ultra-processed food, and all these aspects related to non-communicable diseases. So we will start this. So we will start, we have, on the panel we have Emma Calvert, who is a Senior Food Policy Officer at the European Consumer Organization. Then we have also Anant Yani, who is a research fellow at the Heidelberg Institute of Global Health and also University of Oxford and coordinator of the Feast Horizon project. We have Elisa Markidou, the leads in nutrition at the Ministry of Health in Cyprus. And we have with us also Lena Schilling, who is the climate activist and the youngest member of MEP that from the Green Party. So thank you all so much for being here. I will start with the first question, and I will move on. So I will start with you, Emma, online, and I will ask the same question to all the panelists. So as you can see, they come all for different backgrounds. So I think it will be really interesting to see their different perspectives on the situation. And so the first one, as I mentioned, it's like we want to know why, what is the problem, and then what we can do about it. So the first one, it's really that over the last decades at European and national level, we had several commitments and strategies aimed at rendering our food system healthier and more sustainable. However, when it came to the implementation, too often these strategies, these commitments have been either stopped or been watered down. And so which do you think is the main problem here and what we can do about it? So Emma, up to you.
Well, first of all, thank you so much for the invite, and I apologize for not being there in person. Yeah, I think it's really difficult to pinpoint just one problem when we think about the past decades and the fact that we still have staggering levels of obesity amongst children and amongst adults as well. But I think when you take a step back, I think the framing of the narrative, when you talk about any prevention, public health policies, you often get this reported in populist media or by libertarian think tanks as a quote unquote nanny state measure. And I think this is a really kind of a willfully naive misunderstanding of how food environments work and who really pulls the levers within our food environments. When you look at who sets the policy and also who really influences the policies, individual consumers have much less to say than, for example, commercial actors in deciding what is available or what is acceptable to be marketed to us or even our children. And that's something that we've been working on recently with our Put Change on the Menu project with the European Public Health Alliance and the Eurogroup for Animals, to really stress that our individual choices, our food choices and our drink choices are not made in a vacuum. In a report that we did last year showing sort of good practices, bad practices with the food environment, we actually called it the illusion of choice, because we wanted to stress that we need to stop blaming consumers for making the wrong choices in a food environment which really pushes them towards these wrong choices continuously and relentlessly. And there are numerous and complex ranges of influence which are really beyond the control of the individual, from price signals which fail to take into account negative externalities, the lack of availability of healthier, more sustainable choices in the supermarket, retail promotions. The retail environment is very important. It's something that's sometimes ignored. When you think about buy one, get one free offers, or even the spatial layout of supermarkets is part of the food environment as well, through to what is marketed to us, because we hear this phrase, you are what you eat, but you also eat what you see. And unfortunately, at the moment, what is marketed towards us, and even more so towards our children, is not representative of recommended healthy diet. So we need to really move away from leaving the food environment up to commercial forces to decide what is acceptable for us. And we also need to shift the narrative and stop blaming consumers, because sometimes I think and also we need to be more positive, I think, because sometimes when you talk about prevention, public health policy, you talk a lot about restrictions, but we need to turn that a little bit on its head and make it more about a positive freedom, a freedom to make a choice without the undue influence of the food industry. So we need to move away, because up to now we've really relied on the food industry to set their own rules. So we need policymakers to recognize that has not been successful, and they need to put the health of consumers and also of the planet before the commercial interests.
Okay, thank you so much. This is an excellent start, because it's basically 4 minutes what a systemic approach to food system is. So thank you so much. Anant, up to you.
Is this on? Is this working?
I think so.
Okay. I'll talk about 3 things: incentives, timing, and corruption, with the last one being a little bit difficult to prove, but I think something that people don't talk about. Incentives. So if we look at our healthcare systems, where we have largely fee-for-service models, where you have an incentive to do as much as you can, because healthcare providers get paid for activity. They get paid for hospital appointments, GP appointments, diagnostics, pharmaceutical prescriptions. This is what the providers actually get paid for. The more you do, the more you get paid. And in that sort of situation, you actually have a disincentive for primary and secondary prevention when you have these sorts of financial incentives. And in Europe, 75% of our disease burden is NCDs, as you guys well know. 85% of deaths are due to NCDs, and we spend 700 billion euros every year on these conditions. And these are largely preventable conditions as well, but there's no incentive to actually shift our care models to prioritizing primary and secondary prevention. Instead, a lot of our care models are primarily focused on tertiary prevention. Somebody has type 2 diabetes, and we just take it as a given that a reversible condition is something that people will live with for 30 or 40 years, and they will take their medications every day, instead of helping them to actually try to get it into remission. Same thing for hypertension, cardiovascular disease, obesity, overweight. Then if we're looking at our food systems, there are also a lot of weird incentives. The single biggest spend for the European Commission is in the Common Agricultural Policy, which is about 300 billion euros per year of taxpayer money being spent. And 20% of farmers in Europe get 80% of the CAP benefits. It's largely the massive farmers who are getting these benefits. And they are farming things that are not sustainable and oftentimes not healthy either. So incentives and disincentives. In terms of timing, why do we wait, or why is it at the last minute that these things get watered down? I mean, Farm to Fork was actually, which was this sort of pioneering policy to revamp our food systems, was actually quite painful for me and us in the Feast project. So we wrote this proposal in 2021, and we almost took it as a given that Farm to Fork would be implemented and put into policy. So the way we wrote our 70-page application was, when Farm to Fork is implemented, and these are the deficiencies in Farm to Fork, and this is what Feast will overcome, et cetera, et cetera. We just took it as a given that Farm to Fork would actually be implemented into practice. It was only until the last minute that these watering downs of Farm to Fork happened. And it was only at the last minute that it was basically just suffocated and taken off the table. And from a strategic perspective, that's exactly what you would want to do if I was the people that had an incentive to not have Farm to Fork implemented into practice, because that doesn't give us time to regroup. So how many people have seen Braveheart, the movie Braveheart? Yeah, you've seen Braveheart? Right. So I take you back to the scene where the British are on their horses and William Wallace and the Scots are all sitting, standing there. And, the horses are charging with their lances. And William Wallace, so Mel Gibson's character, he continually says, hold, 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 hold. And then as soon as they're close enough and the horses are committed, he asks them to, he gets them to take these wooden spikes up. So they have no chance of redirecting. And this is what the large multinationals, the lobby groups do, and they're extremely successful at it as well. The last thing, corruption. How many people have heard of the Panama Papers or the Pandora Papers? Just a raise of hands. Okay, so not everybody, but okay, so the Panama Papers 2016, the Pandora Papers 2021. These are leaked documents. These are not things that we found. These were given to us. Pandora Papers in 2021 found that there were 29,000 offshore bank accounts. The Panama Papers, over 200,000. And in the Panama Papers, there were politicians and government officials from 11 European countries representing north, south, east, west of Europe who had offshore bank accounts. In the Pandora Papers, there were politicians and policymakers from 8 European countries who had these offshore bank accounts. Now, these offshore bank accounts are a means by which you can do tax avoidance schemes because you don't have to show your income. That's bad, but what's worse is we don't know where the money is coming from. So you have these other shell corporations who will be giving them money, and this is prime time for kickbacks and bribes. And again, we have very little transparency about any of this stuff. And when we have these closed-door meetings with our MEPs and politicians, meeting with the large multinational corporations and the lobby firms, I mean, it just gets your head thinking. We don't have proof, but it's just a little bit curious that all of these policies that are at the detriment of the multinational corporations, which, like Samuele mentioned, are making billions. The policy environment which the MEPs are voting on is always supportive for them. What is going on? Something's happening. Something's happening. We're certainly losing, the citizens. We're spending 700 billion euros on completely preventable condition of taxpayer money. We're spending 300 billion euros on growing stuff and farming things that are actually harming our environment and biodiversity. That's about a trillion every year of taxpayer money. What is going on?
Thank you so much, Anand. And Elisa, up to you.
That's okay. Good morning, everybody. Thank you for being here. I'm delighted to be invited to this session because for me, it's one of the most important aspects that I work in my career. Let me tell you, I come from Cyprus. Cyprus is a small Mediterranean country that was characterized by the Mediterranean diet that you all know, I'm very much sure, and of good health indicators. Nowadays, our environment, our food environment has changed a lot. We're living in a truly unhealthy environment, an obesogenic environment that supports the diseases, that diseases can come from all the choices we make in this environment. I will focus on the fact that among 38 countries, we have the highest rate of childhood obesity. We have 45% childhood obesity according to WHO COSI program, Childhood Obesity Surveillance Initiative. And that comes out of our environment. I will focus in 3 or 4 items here, and I agree with everybody who spoke before, and I will make it to my country. We have, first of all, an ultra-processed food and an abundance of food that they're not healthy, making it the easy choice to be the unhealthy choice. What we want is to have the healthy choice to be the easy choice. We're just doing exactly the opposite because there is abundance of ultra-processed food, high salt, high fat, and high sugar things. So whenever you go, this is the environment that you find around you. If you go to supermarkets, if you go to schools, if you go everywhere, they support this. Second, I will come and say about the marketing. Aggressive marketing also to the children. A lot of aggressive way of marketing foods that are high in salt, high in sugar again. And there is no marketing of any healthy choice, nothing about fruits and vegetables. We live in a country that we used to have an abundance of fruits and vegetables. Olive oil was in our culture. Now the prices of this healthy food have raised so high, so people cannot buy them in abundance, but on the contrary, they can buy biscuits and they can buy trans fatty acids and sugary things, and that changed their way of eating and the environment that we're living. And then I come and I agree with you that prevention, the money that we spend as a budget, as ministries, as a country, we have a huge budget for health, but not for prevention. Once you get sick, you can get the best treatment in Cyprus, but you have to get sick to get the best treatment. If you want to prevent it, there is no budget and there is no allowance for prevention. Once you have diabetes, yes, you go immediately on medication and you live with this. They don't spend and they don't focus on prevention. So I believe that we're in an environment that we have that we support obesity and we support the unhealthy choices. And this is what we have to focus in, change this obesogenic environment, try and do marketing for the healthy food, put this in the marketing issue, and restrict the marketing to the children, find ways to guide children to get healthy choices and to learn from the very beginning of their lives what a food is. If they learn how we get food, how we harvest food, what is healthy from the very beginning of their lives, then we have a hope that we'll have adults that they will make good choices and that they will change the environment that we will be living in. Thank you.
Thank you so much, Lisa. Do you okay, Lina, up to you.
I hope that works. Thank you so much.
Yeah.
Thank you so much for the invitation. And actually, I want to start where you ended. The question, what is going on? And as climate activists, we realized often what it means to fight against big lobbies, against the fossil industries, and so on. And today I thought about, okay, what should I say about food? You're mostly experts in this topic, and I'm just getting into that. And for me, the one question is, it's really highly political, and it will be in the next terms. I think first we have to realize it's not just affecting our bodies or our health, but our environment, our planet, our climate, our societies, our economic systems. And with that in mind, I just want to drop one number. I'm not a great fan of numbers, but this one is easy. 1/3. 1/3 of the food we produce is wasted. While that's happening, we can see that the food production industry is responsible for 1/3 of the global greenhouse gas emissions. And looking in this next mandate, we will see 1/3 of the whole EU budget will be spent on the CAP. So we see it's one of the most pressing political issues we will face in this next mandate. Just addressing what you said, the Farm to Fork strategy is now part of the mission letter. We will look closely what that means right now, because what we have seen is that much of this legislation was watered down. And you explained some of the aspects I want to mention as well. We can see when we are sitting in the committees, when we discuss with the people about how health, the environment and food production can and should look in the future, that there are visions, of course, but at the same time, they're just big interests. And I think we've seen not just lobbies or groups with interests publishing disinformation, but we have seen in the last term also political parties do that. And we have seen, for me, one of the greatest examples, we can talk about environment and biodiversity, also with the thinking of how food production should work, and then we can look what happened. We have seen a party published just a campaign against the nature restoration law, a really big one. And then we have 6,000 scientists signed an open letter to stop that party just telling lies because they want to threaten farmers. And I think it's good to think about different angles of politics and discuss it in a way. But telling lies and spreading disinformation is part of our political system. And especially when there's so much money involved, especially when there are so many interests involved, that is one of the fields we have to look at closest. And I'm a bit far off from the statement I wanted to set, but it's really good what you said, and I think inspiring, because that's what we are facing for the next 5 years. And with this in mind, I think 3 things are the most important and we have to look at. First, transparency. You mentioned it. We need more transparency in the European Parliament, but especially in this field, because 1/3 of the whole EU budget is just really a lot of money. That's the first thing. I think the second thing we have to look at is the question of a vision. We see the Green Deal and implementing it, maybe or maybe not. I think that's the next question. And with that, how food production can look in Europe. And like the third perspective, and I think that's also an important one, the social justice aspect. Like we have seen, you mentioned it a bit. The question if we have a healthy nutrition or not is often a question of money and in which family we are born. And with these 3 aspects, we can see all the things we need for a good political debate and also a lot of fights coming.
Okay, thank you so much. I think that just from this first round of questions, we have already a lot to talk about. But we will continue now with a second question. So here it was really, what's the problem? And so at the same time, we really want to focus on how do we solve this. So it's, of course, we have no silver bullet. It is such a complex food system that it will really take us days to analyze all the different aspects. But we want just to give one example or one policy that has been implemented or that should be implemented that could really move us towards a healthier and more sustainable food system. So now I want each of the panelists to really give me an example of this policy that could have been or could be implemented. I will follow the same order as before. So Emma, you can start.
Yeah, thank you very much, Samuel. And you took the words out of my mouth. Actually, there's no silver bullet. I think whenever you look at the food environment and all the different and complex factors which create unfavorable food environments, it's clear that we need to have a holistic package, such as the Farm to Fork strategy, which can help to tackle all the different factors. But what I wanted to maybe focus on in this section was something that me or BEUC and our members, we work on a lot, is the lack of action at an EU level, but also at a member state level in protecting children from unhealthy food marketing. It's been mentioned already that we are facing really a staggering childhood obesity crisis. Around 1 in 3 children in Europe are already overweight or obese. And it was mentioned before as well that in certain Mediterranean countries, this is even higher. At the same time, the WHO says that there's unequivocal evidence that the marketing of unhealthy food to children has an impact on childhood obesity, and yet we see the advertised diet bearing very little resemblance to what is a recommended healthy diet. We see children in lower socioeconomic areas being exposed to more unhealthy food advertising. And really what we've seen, unfortunately, at the EU level and in member state level is a reliance on self-regulation. So in the Audiovisual Media Services Directive, which was passed, I think, in 2018, all it says is that it encourages member states to enact self-regulatory codes of conduct, and that's basically what has happened, and it's what we have at the EU level. And this policy area is really no exception when it comes to self-regulation being a failure. And it's a perfect example of what happens whenever we leave a key influence of our food environments up to the food industry to regulate. So at the EU level, we have what's known as the EU Pledge, and it's a self-regulatory, promise from the food companies. So 23 of the largest food companies in Europe, such as McDonald's, Coca-Cola, Ferrero, Danone, etc. And unsurprisingly, it has failed to prevent both the exposure of children to unhealthy food marketing, but also the power of this type of marketing, especially in the digital age, when children spend a lot more time online, and the advertising and the marketing that you see online is very sophisticated, and but also at the same time quite subliminal. It's difficult for children to detect. So when you look at the EU Pledge, unsurprisingly, the nutritional criteria is extremely weak. They say it's okay to advertise biscuits to children. It only applies to kids' TV programs when children watch TV the most at prime time with their families. It fails to respond to how food companies and ad agencies are using digital techniques to tackle or to access children. It doesn't apply to children over 30. So teenagers are obviously a very sensitive age group, and at a very sort of sensitive time of their development as well. And packaging is not included. If you go into the supermarket today, where you will see cartoon characters or branded characters like Disney's Frozen Princess, they tend to be on products which are less healthy for children. So just to sum up, self-regulation, unsurprisingly, has failed to protect children. And where we need to move is we need to move and follow the example of some European countries outside the EU, okay? But the UK has been quite a trailblazer recently in terms of they have passed a law now where they will see a watershed for TV advertising of unhealthy foods. They will apply that online. We're also seeing local authorities in the UK taking action to prevent advertising in their local authority areas, as well as like bus stops and train stations and so on. And I think it's really interesting actually, because very often I think prevention public health policies become a bit of a left-right issue. But when you look at the UK, these policies were actually started by a conservative government in the last term. And I think that's actually representative of the population. I think you hear a lot in the media about prevention policy being nanny state measures, but when you look at the population, there's actually a large amount of support for these kinds of policies which protect children. So we really need other policymakers at the EU, but across the member states to wake up to the failure of self-regulation and start enacting real regulation which actually protects children.
Awesome. Thank you so much, Anand.
Yeah, I'll try to be quicker on this one. A stick policy, an ideal carrot policy, and then a systemic policy. So the stick policy, the UK sugar tax, so this is evidence-based, and there was just something published a few months ago that this actually does help to reduce childhood obesity and to keep the population healthy. So the sugar tax is something that I think is a step in the right direction, and I think something that all European countries should be implementing. A carrot policy that is not implemented, but I would really, really like to see implemented, is getting rid of VAT on fruits and vegetables, particularly for organic fruits and vegetables, and also for plant-based whole foods. So by that, what I mean is dried lentils, dried pulses, dried oats. So we should remove VAT on these items. Systemic policy, farm to fork in its original format was a great policy. I think we should bring it back. The UK's National Food Strategy, in my opinion, took it even a couple of steps further, and I think that's a great policy too. But as a minimum, I think the farm to fork strategy in its original form, National Food Strategy, are systemic policies that I think we should be implementing.
Lisa?
Well, solution is so complex to find, but it should be a holistic solution. I agree with the taxation and the pricing of the healthy food being subsidized by getting the taxation on the sugary thing. We have to work with the industry for reformulation of the process of the foods in high in sugar and in salt and in fat. But I will concentrate mainly on education and empowering families and children. And I will concentrate especially in school environment. We have to concentrate on that thing and have a healthy school environment. The children live in this school environment for almost 1/3 of their days. They're in school and they get food from there, and that food should give them the healthiest choice. Maybe we can provide to all schools meals that they can be followed by the children, but we have to put also nutrition education in schools for the very first year to teach the children how we get food, how the food grows, how it comes to our plates, and how it's being healthy. And if I can take a minute, I will tell you about two pilot projects that we run in Cyprus, in schools. One is called Become a Health Ambassador. It's a very popular program. We do it in children ages 9 to 11, and we get some children that they're influencers in their classroom, and they're interested in healthy thing, and we train them to become the health ambassadors. We teach them what food is, what is a healthy food, how they can sleep well, how they can exercise, how they can put all these healthy aspects and healthy food into their lives. And then we ask them to go back to their colleagues, to their family, and become the health ambassadors. The main thing is that the president of Cyprus comes and gives diploma to those children that they're the health ambassadors, so they feel very proud of themselves, and they work with us in order to promote the healthy environment and the healthy diets we want to have. The other program is called Mediterranean Diet Back to the Tradition. Because if we go back to our tradition as a Mediterranean country, then we will be able to get a more sustainable diet, zero food waste, and get better health, as we know that the Mediterranean people, they had longevity, they lived quite a long with no diseases, with no NCDs in the old ages. So we get the children to come, learn about the Mediterranean diet, then invite their parents and their families to get involved with us, and the children cook for them pulses, vegetables, and really Mediterranean food, and explain to their families, this is what we have to do in our houses, bring back our tradition. Those two pilot programs are running in schools. We wish we could make them running in all schools, but it's impossible because we don't have the budget allocated in the programs. But we have them as a pilot study, so to show and to prove into our politicians and to lobby for it that we need to take action. And we need to start educating the young generation in order to become the healthy generation when they become adults. Thank you.
Lena?
Thank you, and I can agree really on the most things you said, and I think we should talk about things like sugar taxes and really concrete policies we should implement, of course. But at the same time, I think often it's about commitment. We all know these policies and that they would be needed, as well as the farm to fork strategy and so on. But why are we not there yet? We would have the possibility, no? And there's just one example from Austria that made me really angry last year. So we had like this big discussion about the question if each child in Austria should get one healthy warm meal a day. And I think that's something we discuss in many national states, and I think it's necessary to discuss it because I think it should be accessible. And our chancellor said, well, the kids should just eat a hamburger. And there was a video and it was viral. And he was really like, there was a bit of a conflict here in Austria. But we have a chancellor, we have politicians who are leading the countries. And they're saying, the children just should eat a hamburger. It's not that big of a discussion. And I think that's the whole point. The question is about commitment. Do we have the commitment to say, it's worth it. We want a healthy environment for our children. We want a healthy way of food production. We want to save our environment and the nature. We want to protect all of that or not. And that's just a decision. And I think you're totally right. And it's good to do such incentives. It's good to talk about incentives. But in the end, it's about political will and the majorities and interests. And I think we should always keep in mind that when we're talking about food, it's really emotional, I think, for all of us. And at the same time, it's one of the most powerful sectors we're debating.
Okay, thank you so much. I was a bit concerned about the last question because in a way it was a bit of a trap because, as I mentioned, we want to find a silver bullet, one single solution to a problem. And when it gets to systemic, it's impossible. But it was really good because with the panelists, you heard already some, just with one simple answer, how much we can differentiate the policy to be implemented from advertisement, incentives and taxes, education, how difficult it is politically. And so it really gives a bit of an idea, and I hope it gave enough food for thought, pun intended, for the questions. So here we will open to now 3 questions from here to the public. And then I also ask you, Gabriele, if there is a question online, and we can take it there. And then if we have more time, we will more than glad to continue the debate. So are there any questions from here? So we have here 1, 2. One more spot if you want. Is there someone with a microphone? The lady here.
Thank you for the great panel and a very timely issue. I'm Shu Ticho from Taiwan, Taipei. I used to be the Director General of Taiwan's Health Promotion Administration and currently still an executive board member of International Union for Health Promotion and Education. I have 2 perhaps questions or responses. The first one is that always public health approach, anything you proposed will be verified as the nanny state. How do you return to, I think it should not only be the unhealthy profit, it's the man-eater's profit. How do you name it back and make it explicit? The public learn it immediately. Instead of accepting them to call us nanny state, and politicians think, oh, that's something unwelcome, so please don't tell us again to do anything in public health. So we have to return it, frame the message very wisely, toughly, and loudly. Second, we need to rebuild the rule of the games, as this professor said. So when European Union is taxing on carbon footprints for imported goods, how do we, as you mentioned, well-being economy, how do we direct that revenue to pay clinicians for your climate services? Give it another name, not just prevention or health promotion. You are doing climate services. You are increasing people's consumption of plant-based diet. You are increasing people's adoption of green and active transportation. You are increasing babies exclusively breastfeed. But we need to quantify the carbon value in your climate services and ask politicians to solve the health system problem. You are in lack of workforce. Where does the revenue come from? We always say invest in health, but that investment never comes. Now we have the chance, build them together. When the politicians are showing some commitment against the carbon crisis, lead it to support health system to join their climate action. Thank you.
Thank you so much. The other question here, and then this one here.
Morning, everyone. Usman Khan, Kayu Leuven. Fantastic panel, and you really did sort of bring the issues together. I think it's fantastic in terms of problem definition and solutions. I'm just gonna do a little bit agent provocateur, because just to shake things up a bit. The first thing I'm just going to say, looking at this room, we are not looking at an obesogenic environment here. And I think we need to have a little bit of a call out that, you know, I do myself, you know, I went for a run yesterday. This morning I made myself an apple carrot ginger drink with breakfast, which was a nice high protein omelette. You're all doing this, you're all doing the same thing. We are that political community. We're not feeling the impact of the obesogenic environment on a day-to-day basis. In fact, the very opposite. Our life expectancy is increasing, our quality of life is increasing, and it makes for a very problematic policy space because we are not feeling it. We are talking about it, but we're not feeling it. And I think there's a real challenge there. The second one I'd add on, and I'll say it for myself, and you said, I think 1 trillion, you said annual figure. It's a nice figure to be able to have. Take that 1 trillion out of our economy. What does that do to our pensions? What does that do to our economies in terms of growth? I vote for politicians who say, oh, yes, we can grow the economy. And I think, yeah, that's a great idea. Is it a great idea? Because that growth, a large part of it, the unhealthy food environment, ultra-processed foods, are profitable. They are creating jobs, they're creating profits, they're creating wealth. We need to really think about it. We need to, you know, it's one of those ones where it's a wicked problem to be able to unhook. And I have to say, and I don't want, you know, I do this in other things, promote a lot of the programs we have, but it's taking a match to an iceberg in terms of what we're doing. And we can feel better about ourselves. We are living very healthy lives. And then we take a match to an iceberg and say, we've introduced this farm to fork, or we've introduced this or this. It's not doing anything to the wider population, but we can go home and feel a wee bit better about ourselves. So I'm with you, but I just want to be able to a little bit provoke.
Excellent questions. Yes.
Hello. Yeah. Thank you very much. This is Sier from Heidelberg University. I have a question regarding the role of industries on unhealthy food, and of course, how can we address that? So given the very significant role of industries, both on policymakers and people behavior, of course, at the same time, while they're doing very great marketing, like if you could tell or maybe point some specific steps or specific things that we can do to address this issue or this influence, and at the same time keep the balance, and of course give the preference to the public health over the, I would say, commercial profits. So what could be the very specific steps that government could implement to come over this influence from the industries? Thank you very much.
Thank you so much. Gabriella, is there a question from online?
A few questions online reflecting the breadth of topics that have been addressed so far, but picking out just one, it's really around the framing. So one question asks, in the upcoming EU mandate, we are seeing an increasingly dominating narrative around EU competitiveness, making it faster and simpler for businesses. What needs to be done to refocus urgent action around tackling the food system power imbalances? So quite a big question, but I think an important one too.
Okay, thank you so much. I think we have, so I gather four main topics. One, I would like to start maybe from you, Lena, and I think it's really interesting on the aspect of how representative we are or how representative politicians are compared to what is needed from the people or for certain groups. is it the problem that they are not reflected sufficiently? What do you think? What is your view on this, especially because you are the most involved, of course, in the political process?
I think I definitely feel that something changed. So I wasn't a politician before. I'm a politician since 4 months or something like this. And before I was just a young person studying and going on the street and demonstrating and doing politics another way. And with this perspective, of course, I think it's always important to think about from where I am starting. And maybe a bit personal. My mom is a social worker, and I grew up with this thinking of social justice and what that means. And I grew up in Vienna, in a district that's more of a working class district, and there is an extremely difference between the world we are now being in and the world I'm coming from. And with this difference and seeing this difference, sometimes, I have to be honest, it feels completely absurd because we're discussing these policies and you're right, we're talking about people, we're talking about lives, but sometimes we're not feeling it. And I think what makes good politicians is to think about it, step back and think about where we are coming from or who the people we are fighting for. And when I'm sitting here and talking about food policies, I don't do that because I think I'm that important or I don't know, but because I have a serious interest to make the life better for these people. And I think with this empathy and this contact, that's what we need. We can't just be like sitting here and chatting and then we are going. I think we all, in the end of this panel, should go out with the thinking in our mind how to change the world in our possibility from our perspective, but always thinking about the people we are fighting for or what we want to improve when we're talking about health or food or the environment. So I think that's not critical. I think it's a necessary question, and thanks for asking that.
Thank you so much. And another aspect that was mentioned, I think especially about the framing of the next EU mandate, I think, Emma, you are the one that mentioned the most this aspect of the framing. So what do you think about this question? It's like especially the relation of what we mentioned here in the panel and this focus really on competitiveness that seems to be really the center of the next few years.
Yeah, I think we have seen that shift in the past year, I guess, is the focus on competitiveness, on economics. But I think we have to remember that your health is your wealth, and that doesn't go just for the individuals, but the amount of money, as we mentioned already before on the panel, the amount of money that we are spending trying to fix the problems that are caused by the food system, not just our health issues, but also the health of our soils or of our environment is immense. So we see that the negative externalities that somebody has to cover, taxpayers have to cover, and are being covered, is not being reflected in what is available at the supermarket. So I think we need to continue to highlight this to policymakers, because I don't think it's just individual consumers who are not aware of the different factors that feed into the food environment and the cost of the food environment that we have at the moment. But policymakers can sometimes be less aware of these costs. So we need to continue to highlight that and highlight sort of the hypocrisy, I guess, if we're talking about competitiveness and we're not addressing the fact that the workforce are very unwell a lot of the time because of the issues that we've allowed to proliferate within the food environment.
Awesome, thank you so much. So I gathered two other aspects. One is a little bit the connection with the nanny state. I think that was a little bit the core of the question, and then the connection to the industry. So I figured maybe with you, Elisa, if maybe about the connection with the industry and maybe some of your experiences from, let's call it, the ground in Cyprus.
Okay.
Cyprus.
We're working with the industry, also in the European level and also in my country level. We find that they have a positive attitude to work in the meetings, but not in the reality. In the meetings, everything sounds okay and everything is working out, but when we go back to the reality, it doesn't. If I take the reformulation issue that we would like to process, we found that the consumers, they welcome the reformulation products. It was found that salt decrease in salt reformulation, it's the most welcome by the consumers. And from a study done in UK, I think, and in the USA, they found out that the salt intake has decreased by 0.5 gram per day after reformulation process. So I think we have to work much more intensive with the industries. But this again comes to politicians and to lobbying, and back to people. People, I agree, on their own personal lives, they take the responsibility to do a healthy lifestyle. But it has to be supported. And we have to educate people and empower people that when they choose their politicians, they have to look to the whole image of what they're going to do for our countries. Usually we vote and it comes for all the people in my countries. This is a reality. They don't look at the holistic thing. They just vote because they know him, they know the family. We have to be responsible people, and we have to do a lot of lobbying, and that has to come from the decision makers. I go to so many conferences, to so many seminars for 30 years now. We're struggling with obesity, we are saying about health issues, but it stays in between us. I don't see politicians being there and taking action. And that's what, it's our responsibility to bring the right people to decide for us. And we're not doing it so far, I think. Sorry.
Thank you so much. And Anand, I think the last question for you, I think it's really interesting, this aspect of the nanny state especially. So because we mentioned about food system and how complex it is, the systemic perspective, but then food system, we can even go more macro, and we have to discuss it on which is the main economic and political paradigm in this moment in society. So how do you think we can deal with this? Of course, it's complicated in 2 minutes.
Yeah. I guess this notion of a nanny state is something that people talk about all the time in terms of libertarianism, but it's double-sided in the sense that they want some benefits. They want the paved roads, and they want the infrastructure that comes from public expenditure. They discount that positive externality of the nanny state. And if the trains aren't running on time or the roads are flooded, then they complain about the fact that the roads are flooded. And so from the populist perspective, it's sort of perverse because, well, actually, you're now supporting the nanny state to get rid of the floods. Right? But you don't want the nanny state to help you to stay healthy. And I think a lot of this comes down to kind of PR and marketing. And when you get these framings of the nanny state, it's oftentimes for policies where there will be an incumbent who is currently in power who is at risk of losing something. I don't know what the solution to this would be. I think there needs to be more transparency. Your point about us not being representative, I went to one of the cafes over there, just right across the street, and there were about 20 people outside, and I went inside, and the woman asked me, "Would you like to sit outside?" And I said, "No," and she's like, "But it's such a nice day," and I said, "Yeah, but everybody is smoking, because there's a lot of smokers here," and she's like, yes, of course. So then I sat inside. But none of those people are here, right? We don't have any of those guys represented. We're talking about them. So it's a decision about them without them. And I think from a democratic perspective, looking at the nanny state, I think maybe if we integrate them more into the discussions, it might address these questions, and it might also address the question about the nanny state, that if they're educated, like the salt reduction, and if they feel like they actually have a say in what is being done to them, a true democratic conversation, then maybe it wouldn't be a discussion about the nanny state. We can have a rational discussion around why we feel these policies are rational, why they're good for you, why they're good for your children and future generations and the country as a whole. Maybe that's what we need to get back to, is having more citizen dialogues. The citizen dialogue that was done with the farmers by von der Leyen, it was extremely narrow. It was only the big farmers. The small farmers weren't really represented there. You had the lobby groups who said that they were representing the small farmers, but it wasn't really a citizens' dialogue. So maybe this is how we can traverse this issue of the nanny state, is just by involving the people who are smoking and those sorts of individuals, the people that you're talking about, and the people that you're talking about, the working class people, to actually have a say in what policies are implemented.
Okay, thank you so much. So we are towards the end of the session. So thank you so much, everyone, for having contributed. And I will just ask you to close with a really key takeaway message. So try to stay within the minute. I will follow the same order as we did for the question. So Emma, we'll start from you. Your final key takeaway message that you want to give the public.
For the very interesting discussion. Sort of our logo in the Bayek food team is trying to make the healthy and sustainable choice the easier choice for consumers. And obviously we're very far away from that. Individual choices are made within the parameters that have been set by other actors, choices that have been made by people all the way back in the supply chain, including what's being subsidized, for example. So we really need to focus not just on the consumer, but also all along the supply chain on how we can make our food environments a lot healthier and a lot more sustainable. I would say that, if you'd asked me in 2020 about the possibility or opportunities, I would have been obviously much more positive because we had the farm to fork strategy. But it doesn't take away from the fact that we are not going to get a healthier and sustainable transition without tackling diets. So because the political challenges have maybe increased, it doesn't take away from the fact that still needs to happen. And we need to be very strong and united as civil society in stressing that with policymakers. And just to add that, I really like the idea of having citizen dialogues to help communicate these issues of consumers on the ground towards the policymakers, because we see that there's a bit of a discrepancy between what policymakers sometimes think consumers want, whereas when we see what consumers want from our own surveys is that they want to make the sustainable and healthy choice, but they struggle to do that. So we need to impress on policymakers that they need to help consumers get there. Thank you very much.
Thank you so much. Anand, your final message?
We need to have more transparency and tackle head-on corporate capture, regulatory capture, and corruption. Otherwise, I don't think we're going to get anywhere in terms of implementing these policies. They will be derailed. And I think farm to fork in its original form was great. Let's implement it.
Elisa?
Okay, I will focus with a healthy choice should be the easy choice from all aspects, for pricing, from a way to find it. And I will focus deep down on education again. I know I've been repetitive, but I believe so much that if we start educating the children as a normal time, and as my colleagues have informed me from other countries, they want nutrition classes to be in the curriculum of all schools, of all ages, and they grow up with this. Then from the 0 age till the 18, they will be able to be empowered and informed people and consumers and healthy adults.
Thank you so much. I think first I will take the farm to fork with me and try to do my best now in this position. But I think the main thing is just to take something really out here. Not just walk out and do like we did before, but maybe think about what we discussed. Maybe think about what is our perspective and our power in different positions in this world. That every voice matters, and when we are out there and talking to people, that can actually change something. So maybe we can feel a bit empowered and going out and feeling responsible for what happens in the next years, all of us.
Okay, thank you so much. And so we had this hour, we tried to give as much to focus on so many aspects as we could. We hope this was as interesting as possible. So you have the contacts of all the speakers. You have mine as well. So if there is anything you would like to follow up or you want to get in touch, please do. And I really want to thank all the panelists. Thank you, Gabriella, for the support. And yeah, we'll see you in the future. Thank you.